It won't be long until sick season is here. COVID-19 and the flu are a concern, but so is RSV. But there will be new tools available for doctors and patients. And to talk more about this, Dr. Rose Olivero, a pediatric infectious disease expert at Corewell Health, and she joins us now. Doctor, thank you so much for taking the time today.
Nice to be with you.
So there are two shots available, a vaccine and a monoclonal antibody. Both are intended for different groups. What should we know about these?
Yeah, it's an exciting time. It also can be a little bit confusing. The more tools that we have, it can be a little bit confusing to keep straight which we use in which context. So first, let's talk about the vaccines that have been approved for the prevention of RSV. So there are actually two different vaccines that just gained approval this year for the prevention of RSV, and this is an adult vaccine. So two different manufacturers made vaccines. They use similar technology, both gained approval, and they're both effective at preventing severe disease due to RSV in adults. So if you're an adult, a healthy adult, you might be thinking, well, I haven't even heard about RSV being a concern for me. But there are certain groups of individuals who are at higher risk for severe disease, hospitalization, and even death due to RSV. And those are going to sound very similar to people who are at high risk for severe COVID and influenza. So that's our elderly, and also those who have chronic heart and lung disease, as well as a compromised immune system. So those are really the groups that could benefit the most from the RSV vaccine. And just to review what the vaccine is, basically you inject a product into your body that stimulates your immune system to produce antibodies against that infection, so that when you encounter the infection in real life, your immune system is primed and ready to contain the infection, and you generally have much better outcomes and less severe disease when you have had that vaccine. Now, the other product that was just approved is actually a different product, also to prevent severe RSV, but it's actually a monoclonal antibody, which is intended for use in infants to prevent severe disease from RSV. So like I said, this is a monoclonal antibody, which is different from a vaccine. What the monoclonal antibody is, it's basically an injection that provides the antibody directly to the baby's body, so that the antibody is there in the bloodstream and the immune system is primed and ready to help contain RSV if the baby does get infected. And so similar to those who receive a vaccine, the disease severity is much less. So when you get a monoclonal antibody, the important distinction is that it's not a vaccine. You haven't taught your immune system to create its own antibodies against RSV. It is an antibody that's injected into the bloodstream, or to the muscle, and then it goes into the bloodstream. But that actually gets degraded by the body. And so over the course of about 5 to 6 months, the antibody levels will drop down, and so there will no longer be that protection against RSV unless the child contracts RSV and they make their own antibodies. So they're very different products, and they're really targeting the two different extremes of age. But I do have to say we're very excited in the infectious disease community and in the general medical community, because we do see really severe waves of RSV every year. And if you remember this past year, we had a historic RSV season across the country where children's hospitals were beyond capacity trying to take care of all the children who had severe RSV infections. Yeah. So two different tools, really excited for how these can help reduce hospitalizations and death from RSV.
Right, I do remember that. So these are some really positive alternatives to help people. So what are the potential ramifications of this virus? How bad can it get?
Yeah, so of course I'm a pediatrician, so I'm going to focus, of course, on the pediatric audience. The adults are important as well, but pediatrics really does bear the burden of RSV. So RSV is a very common respiratory virus that circulates through the country, generally has a predictable wave. In the Michigan and in the upper Midwest, our peak RSV season is usually starting in November to December, and it lasts about 5 months, so it ends in March to April. With the COVID pandemic, things got shifted. One year we had a very early RSV season. The next year it was early, but not quite as early. But it's usually, we're thinking, fall into winter and lasting until spring. And the reason why children and babies in particular can get so ill from RSV is all about the size of their airways. So RSV is a virus that promotes a really robust immune response, but that immune response actually causes a lot of inflammation and mucus production in the lungs. Now, in very little airways, all that mucus and inflammatory debris can actually occlude the airways, so that actually it's harder for air to move in and out of the airways. And so our youngest babies who have the smallest, lower airways can get very, very sick, have low oxygen levels, and really be struggling to breathe. And I don't want to overstate the danger of RSV, but I think it is really important to note that RSV is actually the leading cause of hospitalization in infants.
Right.
In the United States across the board. So it causes the most ER visits and the most admissions to the Children's Hospital. So it really is a very important infection to think about in the pediatric audience.
Very
now,
serious.
For adults, yeah, it can be very, very serious and can actually lead to very long hospitalizations in the intensive care unit. Now, for adults, I mentioned the higher risk age groups. So we're talking about our elderly, compromised immune systems, chronic heart and lung disease. Certainly the numbers are not as high as what we see in children, but in those select high-risk individuals, RSV can lead to severe disease and death. So it is important for us to think about in our older folks as well.
Dr. Olivero, thank you so much for joining us today. We appreciate your insight on this.
Thank you so much.